Good afternoon. Thank you all for being here today on Tuesday, July 28th. I do want you to know that I am encouraged by the efforts that I see from the people of Mississippi to combat COVID-19. Every day I hear stories that make me confident that we are starting to turn the first corner. People now are paying attention. People now across Mississippi are trying. They are making an effort. Mississippians are wearing masks. Mississippians are social distancing. Mississippians now are taking this seriously. Now, it's not everyone, but it's growing. People understand the damage this can do, and they are increasing their efforts to protect their loved ones. I want to say something to the people of Mississippi who are putting in the effort. Thank you. Thank you for your sacrifice. Thank you for your consideration of your loved ones. And yes, thank you for your consideration of your fellow Mississippians. What you are doing, your sacrifice, is saving lives. Now, make no mistake, we are not out of the woods yet. We are not even close to out of the woods yet. But I want to recognize the good news. Behavior in our state is changing. Mississippians are increasingly protecting one another. We need to keep it up. In fact, we must keep it up. And in fact, we must increase those efforts. We can do this. I'm going to ask Dr. Dobbs to give an update shortly, but first I want to announce a new program that I am very excited about. We are embarking on an effort as a state to rapidly expand access to broadband in underserved areas with a specific focus on distance learning and on telemedicine. We know that there are going to be options for students to learn from home across the state this year. We also know that there are barriers for far too many families. Everyone in Mississippi doesn't have strong, positive internet access that they may need to get a good quality education while staying at home. Now, there are a lot of challenges to fix this. There are a lot of challenges to distance learning than just that. But it's a huge hurdle. It's a big challenge, and it's one we're trying to fix with lightning speed. So with that, I am going to recognize Senator Sally Doty, former Senator Sally Doty, who has taken over the management of the public utilities staff literally within the last couple of weeks and has hit the ground running and done tremendous work. And I want to ask her to explain what is the program that's being launched today.
Thank you very much, Governor. A few weeks ago, the 2020 legislature passed Senate Bill 3046 to provide $75 million, a $75 million competitive grant program for rural broadband from the CARES Act money that was allocated to Mississippi. The public utility staff was given the responsibility of accepting applications and monitoring the grants. The law allocates $65 million for electric co-ops and $10 million for other internet service providers. The $75 million in the legislation is leveraged by requiring each applicant to provide matching funds. Thus, our investment of $75 million in CARES Act money is doubled and becomes $150 million under this program, and actually will be even more than that as several projects plan to provide more than a 50% match. So today we are awarding $65 million to 15 co-ops who applied for the grant. This is such a tremendous effort by these co-ops because the CARES Act requires that money be expended and projects have immediate and substantial impact by the end of this year, the end of 2020, which is really not that far away. The law also requires that grant funds may only be used for unserved and underserved areas. We all know that providing internet service to rural areas is costly and very labor intensive. But these 15 co-ops have taken on this challenge and will be installing 2,765 miles of fiber by the end of this year, by the end of 2020, and an additional 1,980 miles in 2021, for a total of 5,406 miles of new fiber. This fiber will pass 28,447 locations by the end of the year, and an additional 17,309 locations in 2021. Cost for internet service provided to the home will be in line with other internet providers across the state. So we will also award $1.2 million to service providers other than co-ops under the grant program as well. Several of these projects will use fixed wireless to provide broadband to the home. A secondary round of funding will then open up to award any funds that remain in the program. What is not awarded under this program by October the 1st then would revert to the Unemployment Trust Fund by October 1st. The Public Utilities staff, I'm now the executive director of that staff, was named in the legislation to administer the grant. And I will tell you, my staff has worked so diligently with very quick deadlines over the past 2 weeks to review all of these applications. And Governor, I will tell you, when those last few weeks of the legislature, I was a bit focused on other bills. I wasn't watching this as closely as I should have. But now that I'm the director, it's been such a good thing to work with the staff. We have met each applicant either in person or electronically, and we are satisfied that the projects that they have provided and that we are going to award today meet the criteria under the Mississippi Broadband COVID-19 grant program. The public utility staff will be monitoring the grant program with monthly field audits every month from now until December throughout the completion of these projects. Building out this broadband network is very much like what our co-ops did in the early 1900s to get electricity out to our rural homes. Internet is now so integrated in all areas of our life: education, medical services, telework, and economic development. And with the precautions that we have to take to protect ourselves against COVID-19, fast and reliable internet is a necessity and really a lifeline to the outside world. I want to again thank my staff for their hard work. I want to thank Senator Joel Carter, Chair of Energy in the Senate, Representative Scott Bounds, Chair of Public Utilities in the House, along with Lieutenant Governor Hoseman and Speaker Gunn for their work on this legislation. And of course, Governor, I want to thank you for appointing me to this position so I could be a part of this exciting project for Mississippi. Thank you.
Well, thank you, Sally. Just a yeoman's work from Sally and her team. It's a prime example of what can happen when Mississippians put their heads together and get to work. And, you know, Jeff Pender heard me say this a lot during the 2019 campaign, but I'm going to say it again. 200 years ago, people in America located around where there were rivers so that they could get products to and from the marketplace. 100 years ago, people in America located around where the train tracks were so they could get their products to the marketplace. In today's world, people are locating around where there's connectivity. And while the COVID-19 and the CARES Act came about for all of the wrong reasons in my mind, this is one example of a way in which we can take this horrible, horrible, horrible tragedy called the coronavirus, and we can actually invest for the future of our state. And so I too want to thank Senator Carter and Representative Bounds for their efforts. They did fantastic work. We worked very closely with them throughout the process. I'm proud of what they've done. We know that we have to be very diligent in the way in which we spend these funds to ensure that they meet not only state statute, but also the United States Treasury guidelines. Senator Doty and her staff feel confident that we have done that with this grant program. And so we are very, very fortunate in Mississippi to honestly, and I speak with other governors all the time, we are very fortunate in Mississippi that we are being innovative with the funds entrusted to us by the United States Congress. So again, thank you, Sally, for your efforts. At this time, I am going to introduce Dr. Dobbs, who is going to bring us an update on where we find ourselves today with the data. Dr. Dobbs?
Thank you, Governor. So today we're reporting 1,342 new cases, an increase over yesterday as we expected. Sadly, reporting 42 additional deaths. That's certainly one of our biggest reports of death, unfortunately. If we look at where we're going on hospitalizations, we do continue to have significant burden in the healthcare system. Just this moment, I got an update of 977 confirmed coronavirus patients in the hospital, 272 in intensive care, and 178 on ventilators. We have seen some relative stability in the total number of coronavirus patients over the last 3 or 4 days. Certainly, we're happy to see that, but it's certainly not anything that we need to be complacent about and need to be very aggressive about trying to prevent transmission in our community for so many reasons. But one of them is to make sure that healthcare services are available for us when we need them. A few other things I just want to touch on real quickly. We have been getting complaints from different restaurants where the restaurants and perhaps the employees are not following current guidelines under the executive orders. There is a summary of executive orders available on our website, which is available for everyone to review for a simple reference. But if you do notice a restaurant that you think is not following the rules, please let us know. We do have an online complaint form, if you wouldn't mind filling it out, and we will make sure that we contact the restaurant. We will make sure they understand what the requirements are, and we'll also pay them a visit to make sure that they are able to comply with those executive orders. Regarding returning to work, we have gotten multiple requests and questions about if someone has coronavirus, do they have to have a negative test to return to work? Absolutely no. People's tests will stay positive for a long time after they're no longer contagious. Currently, CDC does not recommend retesting anyone who's tested positive for 90 days because we know it can stick around for such a long time. So if someone has coronavirus, they need to be isolated, away from work, and at home for 14 days and may not return until that point. In addition, they must be totally asymptomatic for 24 hours before they can come back. So the duration of time is the indication before someone can come back if they have coronavirus. And the last thing I want to just talk about is we had a myth buster. I did get a notification from someone that they got a positive result returned to them and they had never been to the hospital. We did an investigation, and in fact, it was erroneously entered into the medical record of someone with the same name, but it was a different person. The facility corrected that, and we were glad to bring that to resolution. So if you do get an erroneous report, there could be some quality control issues, and we will be happy to sort of correct those for you. So please let us know if something strange like that happens to you. And Governor, that's all that I have. Thank you.
Thank you very much, Dr. Dobbs. Just as a reminder, we have created COVID-19 executive orders cheat sheets for the people of our state. We know that those are on the State Department of Health website. But just as a reminder of the things that we have done through executive order to limit certain things at restaurants and bars. First, restaurants, daily screening of employees is required. Restaurants must comply with the State Department of Health regulations, orders, and guidance. Employees must be trained in minimization of the spread of COVID-19. We do not allow more than 50% of seating capacity, so no more than 50% of capacity in any restaurant or bar in the state. We require 6 feet of separation between parties and no more than 6 customers per table. 6 feet of separation must be maintained in the waiting areas. We also require we encourage disposable menus. Hand sanitizer must be placed at all points of entry and exit. All food service areas must be deep cleaned. And we also have additional restrictions on bars statewide, whereby bars can have no more than 50% of their maximum capacity allowed. But I will tell you, 50% capacity is very difficult under the following guideline, which requires Bars can only sell alcohol to seated customers, and no alcohol can be sold at restaurants or bars after 11 p.m. Or prior to 7 o'clock a.m. So between the hours of 11 and 7, alcohol cannot be served in our state. We believe that if we will get 100% participation by all Mississippians with the guidelines that are currently in place, we will not be forced to make additional shutdowns of private businesses. That is something that we want to avoid if at all possible. But we do need continued participation doing the little things. That's critically important. I was just on a call with the White House Coronavirus Task Force. They have done a large number of models that basically assume 100% participation on the things like social distancing, wearing a mask in public, staying 6 feet apart, things such as that. And if you look at the models, and these are theory at this point, though they feel very confident, you look at those models, it can have a similar impact to shelter in place that many states did for months and months on end, that we in our state even did for approximately 2 weeks back in late April. So we think that we have a good plan. We've got to allow it to work. We're going to continue to monitor the data. We're going to continue to make data-driven decisions, and we're hopeful that we're going to see a decline in both test positivity rate and total number of cases over the next 2 to 3 weeks. Nothing that we do today is going to have a significant impact for a couple of weeks. It's the nature of this virus, and the people who are going to be hospitalized a week to 10 days from now probably have already contracted the virus, and that's just the nature of the way in which this virus occurs. And so we're trying to be very diligent and very smart and allow for a continuation of economic activity in our state so that we can recover financially. As we have said from the beginning, we believe that if we're smart, we can protect both the lives and the livelihoods of all Mississippians. With that, I'll open the floor to questions. CJ.
Governor, and this is a quote from Michael Osterholm. He's the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. This is for you and Dr. Dobbs. He said on NPR recently that right now we're experiencing a national forest fire of COVID that's readily consuming any human wood that's available to burn. He basically said that contact tracing, quarantining, testing, it's too late for all this and we need to shut down the economy again. He was saying this on a national level, but I have to ask both of you, what do you think about that from the standpoint of Mississippi's strategy for the pandemic and where we go from here?
Thank you for the question. I don't know who this gentleman is, but I would presume that he is someone who is paid by an entity that does not depend upon the economy moving. And I will tell you that the vast majority of Mississippians are small business owners and folks who work in small businesses, whereby if they don't show up for work, they don't get paid. And if they don't get paid, they can't put food on the table for their kids and their grandkids. And so while I appreciate this person's academic pedigree, and I'm sure it's beyond reproach, it's not realistic in today's world that we just shut down our economy for months and months on end and everything will be fine. Having said that, I do think that there is some merit in that the coronavirus is in every community throughout Mississippi, and it's in every community throughout America by and large, and therefore we have to approach our mitigation measures in such a way that recognizes that. And as I've said here daily for weeks on end, we as a state need to assume, or we as individuals, need to assume that if we're in a room with one person or 7 people or 17 people, we need to act as if all 17 of them have the virus. And we need to make sure that we do all that we can to wear a mask, that we maintain social distancing, that we protect ourselves and protect our fellow Mississippians. So Dr. Dobbs may be familiar with this guy, I'm not sure.
Oh, yes, certainly we've been following his thoughts for a long time. Certainly a more aggressive closure policy would be impactful in the short term, there's no doubt about it, but it has to be something sustainable. One of the things that's very important to think about is what's driving current transmission in Mississippi. It's family. We're seeing the majority of new cases we're picking up are from family members, and a lot of it's extended family. So, certainly closing down the economy would stop some of the transmission, but if we can't sort of stop it between family members, we're really going to be in trouble. So just right now, I would like to say, and I know it's kind of a hard thing to think about, please stay away from your extended family. Kind of stay more in your nuclear family, your household. Anytime we get together for whatever reason, if it's a funeral, if it's a family reunion, those are opportunities, and those are opportunities when we let our guard down. So let's just kind of lay low for a while. Nuclear family only, more or less. 6 feet, a mask, basic essentials. If we can give it a few weeks and really slow down, we could see a massive improvement in what's going on in Mississippi. Let's all pull together just for this moment, and we can make a big difference.
I think when you look at the factors that are occurring today, when we were having 200, 240, 260 cases a day, there wasn't a lot of room to make significant progress, because if we reduce the transmission by 20%, well, that was only 30 or 40 cases, right? Well, now that we're having 1,500 cases a day, a 20 or 30% consistent decline over literally a 10-day period would make a huge impact on hospitalizations, on number of new cases, and ultimately on number of deaths. If we would just for the next 2 weeks really buy into the notion that we're going to take care of ourselves and take care of our neighbors by not doing things that we don't need to do. Jeff.
Governor, I know yesterday you talked a good bit about this, but to go back to it, with schools reopening, you said you really want to allow home rule local districts to decide that, but how is that going to be possible without some sort of standardized, so to speak, state regulations? What happens when a teacher tests positive? Things of that nature. How is that going to be manageable without some sort of statewide mandate?
Well, and it's a fair question, and it's a tough question, and it's one that we're spending a lot of time contemplating right now. We do have one school district that is back in school, and so we'll be able to watch and monitor what's going on in the Corinth School District. They certainly have very capable, competent leadership there, and so I am monitoring that situation very, very closely. I do think that those individuals and individual school districts that have opined that they want to go 100% virtual ignore the reality that we are going to have testing that occurs in the 2020-21 school year. And so, I don't think that 100% of our school districts are approaching this in exactly the right way, but we'll have more information on the end of this week. We'll have every single district that has put in as to what their reopening plan is. We have gotten a number of them, and there's actually a spreadsheet that I literally reviewed for about an hour and a half this morning, and we'll continue to review it late into tonight and through the next 3 or 4 or 5 days. If we believe that a statewide approach is going to be necessary, then we are going to look for ways in which to make that happen.
And to be clear, that would be you, not MDE, from what MDE is saying?
Well, I think that's right. But to be fair, I have a very good, strong working relationship with the Department of Education, and we meet regularly. And Dr. Dean and Dr. Wright are both very capable, competent, want to do the right thing for kids. And so we wouldn't do anything unilaterally. We'll work with them. But at the end of the day, they probably believe that they don't have the authority to mandate a statewide plan. and we're probably would have to be creative to find a way for me to do so. But it's not something that I want to do, and it's not something that I can tell you with certainty that I'm going to have to do. Although there are, I will also tell you that many of the same people who for years have said stay away from them and stay out of their business now are calling me asking me, hey, will you please make these decisions for us? It's the nature of the beast, and the one thing that I think those of you who have watched me over the last 16 years, 17 years now will know is that I am not scared to make a decision. I'm going to do what I think is best for the kids, and we'll let the politics play out however they may play out. Yes, sir.
Governor William Owens, this question is for Dr. Dobbs. What's your take on high school sports continuing throughout the pandemic? And in addition to that, what's your take on high school athletes transferring to schools that will allow them to actually play?
That's a tough situation, and it's hard to imagine sports as we know it going through the fall. And I'm just going to say it right now. It's hard for me to imagine people sitting in the stands. It just seems like, at least where we are in the pandemic, that's not really a safe thing to do right at this very moment. The Florida Marlins. I mean, look at what happened. I think the virus is going to make decisions for us, honestly. And if we look at what happens when it gets into a team, I mean, it really undermines that team's ability to do what they're planning to do. I think it's going to be exceedingly difficult to have a cohesive season of any team sport that requires proximity. Can we run cross country? Yeah, sure, you bet. Are there some things like that we can do safely with people who maintain social distancing through most of their sort of athletic endeavors? But it's going to be really tough to field a team when you constantly have people out on quarantine, on isolation, or you have big outbreaks. And these spill over into coaches, into assistants and trainers and those sorts of folks who maybe won't fare as well. So the virus is really going to make it tough, I'm afraid.
How do you feel about, high school athletes that's going or attending schools where they cannot play, transferring to schools where they actually would be able to play?
Well, I would hope that we'd have a standard response for all schools, for at least for that piece of the puzzle. And from our conversations with the schools, the school districts want to have a standardized sort of approach to the athletics question.
Faith Elliott with WLOX has a question.
Thank you, Renee. Dr. Dobbs, this question is for you. Restaurants and bars violating the executive orders, capacity, face masks, whatever it might be. I think everyone knows that's going on. You're encouraging citizens, maybe even employees, to report that. Well, then what? What kind of manpower do you have to follow up, enforce, and if necessary, could the health department shut these establishments down?
Yeah. So there's multiple layers to this, and this is as a regulatory agency. A lot of what we do is this sort of thing, and the first three stages are going to be education and compliance plans, and getting things back on track. We have had some of this happen. We've been visiting multiple restaurants so far, and once we meet with folks and make sure they understand, and they understand that we're going to pay attention to this, we've had some pretty good compliance so far. But if it's a safety issue and a restaurant is absolutely unwilling to comply with the necessary safety standards, yes, we will close them down. We close restaurants down for other hygiene issues. Hepatitis A outbreak, salmonella outbreaks. It's just a different infection. So we do believe, though, that with some collaborative, positive reinforcement, that we can get pretty near universal compliance. But when we do hear about it, we're going to make sure that we can get them where they need to go.
Renee.
Leo Willingham with Associated Press has a question. Leah?
Sorry, I'm here now. Thanks, Renee. Governor, you and Dr. Dobbs have pointed to bars as ground zero for community spread of the virus in many cases. Why not shut down bars specifically just for a period of time, as other states have done? Wouldn't that send a strong message that the kind of irresponsible behavior you've been seeing won't be tolerated?
Yeah, well, thank you for that question, Leah. I do think that it would send a message. The problem is that for the vast majority of small business owners that operate bars and in many instances restaurants, it would also send a message to those small business owners in Mississippi and to their employees that you simply don't matter, and that what you do is earning a living for your family is not important. And so, the reality is, on every single decision we make with respect to trying to slow the spread of this virus, we're trying to make those decisions to mitigate risk, to do it in a smart, sensible way, while also protecting the lives of our fellow Mississippians, but also understanding on the other side of the coin is we've got to also try to protect the livelihoods of the literally tens of thousands of people who work in the restaurant and bar space in Mississippi. They're getting up and going to work, and they are providing food for themselves and their kids, and in many instances their grandkids, and taking away their livelihood is as dangerous in many instances as is the spread of the virus. And so, would the easiest thing be to just shut everything down and pretend like it doesn't hurt anybody? Absolutely, that may be the easiest thing to do, and that may be the quickest thing to slow the spread of the virus. But there would be innumerable other consequences to doing that. And so every decision that we make, we try to weigh both of those sides of each coin and try to make the decision that impacts the smallest number of people. No decision that we've made since March has had zero negative impact. Every single decision has had a negative impact on somebody. What we try to do is make decisions that have the most positive impact while minimize the negative impact to others. Yes.
Yeah, this is for Sally Doty. I wanted to ask, whenever it comes to the rural broadband, what speeds are y'all trying to get it out for people in Mississippi? And then what areas do you think are going to take the most amount of work to get that speed, get that in there?
So the legislation required 100 up and 100 down. So we had that requirement in the grant applications, and that is what we're expecting. We got a lot of grant applications from the northern part of the state, and I think we still have a lot of work to do in the southwest corner of the state, which is where I'm from. So I really hope that we can do some work on that in the future.
And as the virus pandemic goes on, and we're facing people working from home, whether it be their jobs, say, hey, just work from home for now, or even have students having to do schoolwork from home, how do you think that's going to help those students or help those people that are trying to work in the coming, maybe next year?
Let me just say one thing, and I'll turn it over to Sally, but hopefully at some point this pandemic is going to end. I don't see the end in sight, but hopefully at some point it is going to end. But the reality is the economy in America has changed forever. There are a large number of people who were working in office buildings 6 months ago that 6 years from now are going to be working from home. There's no doubt in my mind that that is going to be the case, that you're going to see everything from computer programmers to call centers to other types of individuals that are going to work from home. And the reason for that is that there are a lot of employers across America, and I've talked to many of them, there are a lot of employers across America that have actually seen increases in productivity from their workforce when they were working at home. There's a lot of reasons for that. One, you give these individuals more flexibility, and they may not work from 8 a.m. to 9:30 a.m. because they want to sleep late, but they may work till 9:30 or 10 o'clock at night because they've been able to put their kids to bed and they've got more time and they can be more productive. Another example is you have 100 people on one floor doing computer programming. Well, invariably somebody's going to come in your office or come in your cubicle and start talking to you about the Florida Marlins and the fact that they had 17 people test positive for the coronavirus. That reduces productivity. Well, if that individual is staying at home, they don't have that interruption and that loss of productivity. And so I just want to point out that certainly these investments that are being made are going to be helpful with respect to us getting through the pandemic. but let's not forget that they're also going to be exceptionally helpful in terms of ensuring productivity, so that those individuals that currently don't have strong connectivity get it, and therefore they can be more productive in their jobs. But also the effect of telemedicine. There is no question that there has been a large increase in the number of telemedicine visits that have taken place, and I have personally witnessed it, as I've had a child go through some challenges over the last couple of months, and literally she has had the opportunity, and her mom have to do telemedicine visits with experts in dealing with what she's dealing with. And so telemedicine is going to be a major player going forward, and these investments are going to play a major role in that, so that not just those in Rankin County or in the Metro Jackson area have access to this telemedicine, but more and more people all throughout our state have access to it. And that's what excites me the most. I'll let Senator Doty.
And we hope that we have some real immediate effect for the 2021 school year. As we talk through these grant applications with the co-ops who, you can only lay fiber so fast. They think, and they're gonna hang the fiber on poles. And they think they can run 20 miles of fiber a week. So, it takes some time to get that done, and we talked with our applicants about, during the meantime, having some hot spots in the community and offering some free Wi-Fi there, because we all know, we've seen people parked all around the public library or in the McDonald's parking lot so the kids can do their homework, or so mom and dad can do their work. So we're looking for some real immediate help, and then a more long-term investment in building out this fiber. And I also want to stress that the grant required this to go to unserved and underserved areas. So the public utility staff identified the census blocks that are out there that, according to the FCC map, are unserved or underserved. Now, we think that map is a little bit erroneous, and in fact, there are many more areas in Mississippi that lack adequate service. So we have a lot of work to do in Mississippi, and this is a step in the right direction.
5,406 miles of new fiber is what is anticipated from this program alone. That is certainly a step in the right direction. Jeff?
Governor, back to the schools issue. Another thing, I guess, that seems like it would be a big potential is extra cost, PPE, distancing, needing more teachers or assistants. If someone gets sick, having to hire more substitute teachers or whatever. Do you anticipate problems there with schools being able to afford this, or what's going to happen there?
Yeah. I don't anticipate problems there. Certainly challenges, but as a reminder, the initial CARES Act delivered approximately $300 million to school districts across the state of Mississippi for the acquisition and purchase of PPE and other things. The Mississippi the state of Mississippi has provided an additional couple $100 million through CARES Act funding that will go towards things like new technology, new opportunities for teachers to train, things such as that. That was a program that was initially asked for by the Department of Education. I endorsed their plan. They didn't get exactly what they wanted from the legislature, but they got a really good first step and a really good start. So the combination of those two pots of money are going to provide over $500 million to our school districts. In addition to that, in my conversations with our leadership in Washington, D.C., it is, including with the Vice President within the last hour, it is my anticipation, certainly the Republican plan, and I don't see any reason why the Democrats in Washington, who have proposed $3 trillion of spending, I don't think they'll disagree with any spending, but that the Republican plan does call for a significant portion of the additional monies that they're talking about in the fourth CARES Act package going to the restart of schools. So again, let me just sum this up by saying over $500 million in money has already gone to our directly to our K through 12 school districts for COVID-19 related expenses, and I would anticipate that there will be more money on the way. If there's a deal in Washington, I would expect there to be more on the way. So will there be challenges? Absolutely. I don't want to minimize those, but I don't think they'll be financial in nature. Yes, sir.
This is for Dr. Dobbs. As you mentioned earlier, we had actually the second highest number of deaths today. I know that a talking point from a month ago nationally was that deaths are down, we're trending down. We can't really say that at this point if you look at the 7-day average. In fact, today we hit an all-time high of 22 deaths. Can you talk about that and what you anticipate happening in the coming days?
Yeah. So it's not much of a surprise to folks who've been paying attention. Deaths follow cases by weeks. If we think about the natural time course of infection, someone gets infected, they get diagnosed maybe several days later, get hospitalized 10 days later, and then maybe stay in the hospital for weeks before they don't make it, sadly. So it's a lagging indicator. We always knew it would be. So when we saw the sort of discrepancy between new cases and deaths, there were a couple of factors, right? I mean, part of it's the time lag, and part of it was the age group of folks getting it. But as predicted, the young folks had a pretty massive increase in number of infections in that sort of like 18 to 29-year-old age group. But it doesn't stay there, right? It moved on into older age groups, into nursing homes. Our nursing home outbreaks have just skyrocketed since we had our lull back at the end of May and the 1st of June. So it's not remotely surprising. And because we've had such a high caseload over the past couple of weeks, we can expect to see more hospitalizations and deaths going forward for, at least a month. Anything we do now that's going to have any positive impact on that is not going to be seen for weeks, unfortunately.
Yeah, and I would just, as I've said before, and in trying to convey this message to the people of Mississippi, there are those who say, correctly, I would argue, that a large number of the new cases that we're having now are in those age groups where the mortality rate is significantly lower. And so, for instance, we now, almost half of our cases in Mississippi are from those under the age of 39. We have literally 26,000 cases confirmed in Mississippi, almost half under the age of 39. There are only 33 deaths in Mississippi amongst those under the age of 39. This is data directly from the Department of Health website. So that sounds like really good news, right? Well, some people take that and say, well, it's not that big a deal because it's just spreading amongst the young people. That is wrong. That is not the way you should look at this, because what ultimately happens is the young people go back home. There's a bunch of 25-year-olds that live with their mom and dad at home, maybe in their basement. But even if they live with their basement, live in their basement, they tend to eat dinner or lunch or breakfast or something with them, and invariably it's that second iteration. It's the under the age of 39 gets it, they're healthy, the likelihood of death in that age group is relatively low. But if they give it to their mom, or God forbid their grandmom or their granddad, that's where we start seeing the fatalities. And it is not lost on me that the uptick in number of cases started occurring in Mississippi in mid-June. Here we are, almost to August, some 45 to 50 days later. It wasn't that uptick that occurred in mid-June that caused significant amounts of deaths. It was that first and second iteration of the transfer and the transmission of the virus from those in the younger age groups to those in the older age groups that are significantly more susceptible to death. That is the way we have to look at it. When we look at a 20-year-old that has it and say, it is highly likely the 20-year-old is going to get well and be fine. So that's okay to say. But when you then say, so it doesn't matter if that 20-year-old gets it, then you completely ignore what this virus really means to people, and that's the second iteration when that 20-year-old gives it to mom and mom gives it to grandmom, because the likelihood that grandmom is not going to fare well is pretty high. I mean, you look at the rates amongst those in the 60 to 69 category, 70 to 79 category, and particularly above 80, it is really, I don't want to say it is a death sentence if someone in that age group gets it. It's really hard for them to recover. And even if they recover, and again, this is something that a point that Dr. Dobbs has made repeatedly, even if they recover, it's not like it's a 0 or a 1. It's not like I recover and it's as if I never had it. There can potentially be lingering effects for the rest of those individuals' lives, and their quality of life can be much worse. And so that's what we're trying to convey is, let's not just think about the first iteration. Let's not just first think about the transmission between one 24-year-old to another one. Let's think about what that means 6 weeks, 8 weeks from now. And what it means is what you saw today, and that's over 40 deaths. That's just, and by the way, this is not surprising. This is what we've been saying for quite some time. And so I am very upset that what occurred 6 weeks ago occurred. I'm very happy that we are beginning to see more and more people participating in our state, and I think it's going to have a significant impact. But again, the numbers are not great where we find ourselves. Yes, sir.
Governor, I guess William Owens first, but I guess I have a two-part / two-person question. The first question is for Dr. Dobbs. We were just talking about schools, so what do you feel about teachers when it comes to it, when it comes to students coming back in the classroom? What risk can teachers, expect when it comes to it? And for the governor, are there going to be extra or added benefits when it comes to teachers working through the pandemic?
Yeah, so without a doubt, we know that anybody in the workforce, there's going to be some risk, and certainly want to do everything we can to mitigate those risks. And there's special challenges for teachers. Depending on your age group, there'll be different sorts of challenges. For the sort of preteen sort of age groups, they're just as likely to transmit it as young adults, but they might be a little bit more easily controlled as far as social distancing. A big might, no, keep in mind. But can follow instructions, and you can do social distancing. And so long as you can maintain that social distancing, wear masks, it's going to be pretty safe. Younger kids, it's going to be a different sort of challenge. They're less contagious, most likely, so that's a benefit, but the social distancing piece is going to be tougher. There's a lot more hands-on stuff that's required. So it would be a lot easier if we had less coronavirus in the community. The chances would be a lot less, so everything we can do right now to get it down as we go into the school year is going to be super duper important. And it may well be that some schools are going to have to close pretty quickly whenever they do open, depending on if there's outbreaks or not. But there are safe ways to work, and everything we need to do, we need to make sure we do the social distancing, the diminished size groups where we can, and universal masks in schools is something that we're going to recommend from a public health department. That's something that needs to be done. Yes, sir.
How difficult do you think it will be when talking about schooling for, preschoolers or daycare to make sure that throughout their day of schooling that they wear a mask?
For the kids, you mean?
Yes.
Yeah, no, it's going to be tough, but it's going to be important for the teachers too. And if you're little kids, we understand that's not going to work out as easily. But we never closed down the daycares, and I'm not saying that there hasn't been transmission or cases, but we haven't seen massive outbreaks around it. So there are safer ways to do things. I mean, this is a pandemic. I don't know that we know exactly the best how it's going to work out, but there are safe ways to approach things, and we got to approach it as safely as we can, and then monitor closely to make sure that we can pull back or alter if we need to.
What I would say is, it appears that there's a growing consensus that the mid-teen years and above, I don't know if it's 13 or 14 or 15 and above, those who are nearer to the age of adults are certainly more likely to spread the virus, it appears, than, say, someone who are 7 or 8. It also, I think it's factual that it is more likely that a 15, 16, or 17-year-old can actually get quality learning opportunities out of distance learning, whereas it's really hard for a second or third grader to do that. And so we're going to have to be willing to be nimble in the way in which we approach going back to school. And I think that's important. Back to the previous question, because I think it's important that everyone understands these numbers. And again, I'm doing these in my head, so they're not going to be precise, but they are going to be accurate. For the age of 60 to 69, currently we have 327 fatalities in that age group with 6,000 confirmed positive cases. That's just over 5% of those confirmed cases of COVID-19 of people between the age of 60 and 69 have passed away. That's 1 in 20. If you have a mom or a dad, or you are currently in that age group, I don't think you should like those odds that you have a 1 in 20 chance. If you go to those between the ages of 70 and 79, we've had 409 fatalities out of 3,654 confirmed cases. That is approximately 11%. So you have a less than 1 in 10 chance of passing away, or you have a 1 in 10 chance of passing away if you're in that 70 to 79 age group. 80 to 89, we've had 344 fatalities out of 1,949 cases. That's approximately 17% of all confirmed cases end up with a very negative outcome of a fatality. Think about that, 17%. You have approximately just under a 1 in 5 chance of passing away. It's an 80% rate. If you go to those over the age of 90, 208 cases out of 746. You have a 1 in 4 chance of passing away if you're over the age of 90 if you get the coronavirus. And so again, there are real implications to being 25 and going to a bar, getting the virus and spreading it. Because it could be your mom or your grandmom or your dad or your granddad that's in that category. Renee?
Jackie with WHBQ has a question.
So you spoke about the majority of the new cases recently being from gatherings with family. How do you determine that? And would you say it's being spread because of young people that are going out and about and they're passing it back to their family? And I have a follow-up question.
Yeah, so there's two lines of information on that. One of them is we know that a large proportion of our cases, and I think it's around 40%, are from family members, like a first-degree family member. So that's pretty bold, that's a lot of it, because once it gets into a family, it spreads within a family. So that secondary tier is really huge. And the other one is personal interviews that we've been doing, asking folks how did they get it. And I mean, we didn't. Well, sometimes we do ask them, how do you think you get it? And it's pretty clear. It's actually not as hard to figure out as you might think it would be. It's almost always 4 to 5 days before symptom onset. And there's clearly something that happened. It was a birthday party or a funeral. But a lot of times it was so-and-so's cousin was in from out of town, and we all got together to welcome him home. And a bunch of people got sick. It's not subtle. It's pretty obvious. So a combination of different data points. But in Mississippi, that seems to be our weak point. We don't have big bars are important. There's no doubt about it. Anytime people congregate. But even in some of the restaurant outbreaks we've looked at, it's groups of people who get together, quite frankly, in violation of the current orders. 6 at a table is the maximum. If you got a group of 10, they're having a party, and they spread it around each other. It's among friends mostly. So, socializing is kind of a dangerous endeavor right now.
Okay, and in terms of my follow-up, you mentioned that you believe that some of the cases have stabilized over the past few days. Do you think it's because the bars have not been serving alcohol at 11, or what other factors do you think would be contributed towards that?
I don't know that there's anything that we've done this week that have had any impact. Well, I know there haven't. We're looking at future impact right now. We've just seen a flattening for the past few days on the number of ICU patients. It may mean that a couple of weeks ago people were starting to get scared again. when we started seeing things going up. Mass psychology has been very difficult to follow because there have been subtle shifts. But I have seen over the past couple of weeks when I go to restaurants or go by the coffee shop or whatever, that I see people who are wearing masks, and I see people taking it a little bit more seriously. It doesn't take it takes a lot, but it's not those big of steps that are going to make a big difference. And so if we're really diligent right now and are serious about it, and if all the leaders, if you are a person of prominence in your community and people listening to you, please tell them the right thing to do. Because if you don't, they're going to do the wrong thing, and that's going to drive us right back into the hole.
Business leaders, political leaders, religious leaders, we need your help. We need you to help us spread the word of the importance of doing the little things. And just to quantify, put a quantity on the question that was asked with respect to young people, the second largest category of individuals that have tested positive in the state are 30 to 39-year-olds. And 30 to 39-year-olds, we've had 8,401 confirmed positives. Between the ages of 18 and 29, we've had 11,822. So almost exactly a 50% more between 18 and 29 than the second most category, and that's 30 to 39.
David with WLOX has another question.
Thank you, Renee. Governor, your executive order in the 29 counties, and that includes Harrison and Jackson counties, excuse me, with the mask mandate. I've had school superintendents in those two counties tell me they're very frustrated. They have been told that staff, teachers, and others must wear masks under that executive order 1509. What they haven't been told, and they want clarity and they want it now, is whether or not that applies to students. In other words, are students under that executive order in Harrison and Jackson County required to wear face masks at all times?
Well, thank you, Dave. I appreciate the question. You are more than welcome to tell those same superintendents that I'm very frustrated as well. So lots of frustration exists in today's world. None of us believed that we would be where we are today. We are certainly in the process of updating and reviewing exactly what those orders are. When we put the orders in place back the 1st of July, maybe actually the last weekend in June, if I remember correctly, in Harrison and Jackson counties, we were not contemplating that schools would be a week or two out, but we are certainly in the process of reviewing that, and we will provide clarification sooner rather than later. But what I've heard Dr. Dobbs say is it is highly likely that the health department is going to recommend that students wear masks, and so we'll be having those conversations in the coming days.
Governor, and this is for Dr. Dobbs. So I wanted to ask you about a video that's been widely shared recently on social media, even retweeted by the president, where doctors in lab coats are saying that hydroxychloroquine has worked. One claimed a 100% success rate from what I saw. I noted that you tweeted something this morning about what we know so far about the drug. But what can you speak on that, and then also talk about concerns as a medical professional of other doctors saying things like this in the video and just putting it out there?
Well, there's black sheep in every family, right? So, and we see some physicians say some things that are probably outside the bounds of what's scientifically proven. We got to base it on the science. If there's been all these sort of observational things that people thought that vitamins would make a difference. Like with lung cancer, there was one where people thought if you gave people vitamins that their lung cancer progression would be better. And when you did it in a real trial and you randomized them and you followed them over time, it actually made it worse, right? So what seems like it makes sense from people's observations outside of a scientific sort of design, we get it wrong all the time. So what we have seen, and New England Journal had an article that just came out recently, I think the 23rd, showed very clearly in a randomized controlled trial that hydroxychloroquine had no benefit. It doesn't mean that additional trials aren't worth doing, but there are clear toxicities that were found within this study, and so we just got to follow the science. And if anyone wants to say, yeah, we need to study something, that's great, but someone's personal observations outside of a clinical trial we really don't need to call that science. And it's just not science. And so, but there are treatments we do that do help. I mean, supportive care, obviously, we can get people through it just with good standard medical care. But dexamethasone and remdesivir show clinical benefit. So we can't give up on science just because folks are fixated on this drug.
I just want to be clear. I have no opinion on what drugs work and don't work. Any other questions? Seeing none, I want to thank everyone for being here. I really want to thank the people of Mississippi for your efforts. There is no doubt that we are seeing significant participation. We are seeing significantly more masks worn, not only in counties where they are mandated, but throughout this state. And it is going to make a difference. I need you to continue to do it. I ask you to continue to do it. I urge you to continue to do it. Socially distance, wear a mask. Let's be smart. Let's put in the work over the next couple of weeks, and we're gonna make a huge difference for the people of our state, and we're gonna protect ourselves and protect our neighbors. So thank y'all, and God bless.